Peggy Johnson, what about stevia and erythritol? Because that's how I eat any sweets. I eat them every day. Okay, so that's a great question. And let me just take a few minutes and talk about the non-nutritive sweetener story. Back 30 years ago, about the only thing that was available was saccharin. There was a huge scare about saccharin causing cancer, specifically bladder cancer, because it happened in mice. Even 30 years ago, there were those of us who looked at that and said, you really don't have a significant record of increased risk of bladder cancer in humans with saccharin. And you go back and you look at the mouse data, the lab mouse data, and they were basically giving the mouse what an equivalent to the human would be about a pickup truck full of saccharin every day. So we still don't know the answer in terms of humans. If we had any human that actually took a pickup truck full of, it may cause bladder cancer for that human. I don't expect that study's going to be done anytime soon. But let's go to another view of this. There's clearly evidence that non-nutritive sweeteners do impact the gut biome. I reported on that a couple of years ago. It was some research that came out of Israel. And the gut biome is very, very important. They've done studies which demonstrate, look, if you transfer the gut biome of someone that has insulin resistance or diabetes to lab animals and even to other humans, it's been shown, you will greatly increase the recipient risk of developing insulin resistance and or diabetes. So there is something to the gut biome and insulin resistance or diabetes, as well as there is to many other health determinants. Now, one other side to this non-nutritive sweetener, saccharin was 30 years ago. Now you've got a ton of things. Just an update, I will tell you that there's been significant research indicating challenges with all of the non-nutritive sweeteners that I'm aware of, at least in terms of gut biome issues. That's obviously not as hard an outcome as full-blown cancer, but you still do see that. You haven't seen them, or at least I haven't seen them in terms of the science, any significant evidence that you get that from stevia. So here's my personal read on it. I do use stevia, and I'm not concerned at all about stevia. I'm more concerned about any of the others, the yellow packets, the pink packets, which are saccharin, several of the others. Now, things like monk fruit actually have sugar in them. Erythritol is actually a pretty good one. It's expensive and for that reason, you don't see it used a lot. A couple of other points about the non-nutritive sweetener. I've been a non-nutritive sweetener addict for a major part of my life. I've gotten sick of it. One of the things I've started doing is putting Jim Nimma in my morning coffee. I've got videos and what else I put in my morning coffee, but Jim Nimma is known, it's an ancient Ayurvedic medicine known as the sugar killer. And what it actually does is it coats the sugar taste receptors in the back of your tongue and palate. You can tell it by drinking or putting some Jim Nimma in your mouth. Then you go to ingest something sweet, whether it's a non-nutritive sweetener or sugar, and it just doesn't taste the same. Out of my whole life, I've tried multiple times to decrease non-nutritive sweetener addiction. I'm making significant progress now with good old-fashioned 3,000-year-old Jim Nimma. Or maybe it's 1,000 years old, but it's a very old intervention. Let me just say one last thing about non-nutritive sweeteners before we move on. You'll see a lot of research out that says, oh, you gain weight with non-nutritive sweeteners, you get diabetes with non-nutritive sweeteners, et cetera, et cetera. Those are environmental studies, meaning you look at people that are using non-nutritive sweeteners, and then you look to see how many people in each population, users and non-users, have diabetes or obesity. Or you can do it the other way and look at people that have diabetes or obesity versus controls, and then look at non-nutritive sweetener use. Clearly, guess what you're going to see? You're going to see non-nutritive sweetener use linked with people that have diabetes or insulin because they don't want to take sugar, and with people that are obese because they're trying to cut back on their calorie intake. Let's go back. So you're always going to see that in the science. When you do see that on a specific study, look for that bias, because that is a study bias. That really doesn't mean anything in terms of the non-nutritive sweeteners themselves. Final point on non-nutritive sweeteners, and I'll move on. Look at the diabetic population. Look at Richard K. Bernstein. He's the godfather of diabetic self-care. He still uses non-nutritive sweeteners a lot, recommends them, despite having full-blown, very brittle diabetes in his 30s and using non-nutritive sweeteners up through his 80s. He did not have a problem. And all he did all his life was manage other diabetics and did not see problems with non-nutritive sweeteners. So yes, there's some soft signals that non-nutritive sweeteners are a problem. They're very soft, and even those soft signals, and they have to do with, again, gut biome kind of stuff. They don't have to do with diabetes. The signals up in the research regarding diabetes and obesity, again, very unclear, not something I would worry about at all because of the bias issue. Overall, it can't be good to be taking a chemical in, so I continue to try to work my own non-nutritive sweetener addiction. Of any of the non-nutritive sweeteners, stevia and erythritol by far the best. My name is Ford Brewer. I started off my career as an ER doc, and that can be frustrating because most of the things bringing patients into the ER can and should be prevented, like heart attack and stroke. So I went to Johns Hopkins for training in prevention, did well, ended up running the program, trained dozens of docs there, and have trained hundreds and even over 1,000 doctors since then in preventing disease. What's even more important is I've helped thousands of patients prevent heart attack and stroke rather than waiting for the devastation and hoping for a cure.